Thank you very much, Mr. Speaker, and it gives me great pleasure to give my fifth report of the Chief Executive Officer to the Council. As far as disclosures, I do have no financial disclosures, but have to disclose that I have thought of my ACR dues since becoming a full-paying member in 1984 as profession insurance, and I guarantee you it's been money well spent. The objectives I'm going to cover today are to highlight a few of the many significant ACR awards and accomplishments that have occurred since the Council convened last year, and then to describe our ever-increasing engagement and impact of the College through our external relationships and the high credibility that we've maintained in all of those spaces. So for those that can't read the caption here, welcome to D.C., and the caption says, "You're clear to board the plane, ma'am, but your appendix looks like it's about to burst." We don't want the TSA getting into the diagnostic radiology. We are very proud to announce, and it's been on our website, as I'll show you in a minute, that the ACR has been qualified and certified as a great place to work. This is an independent organization that, through a survey process of all of our staff, has permitted us, and we're gauged against the 150 top companies in the country that they've surveyed, and I'm really, really pleased for having achieved this certification process. Questions are across multiple domains, and we had to qualify in each of these, and it has been really, as I say, here's the website when we announced that when it was first accomplished. My thanks to our HR staff who headed this effort. You can see we were preparing for a celebration amongst the staff not too long ago. And you can see the poster there. A super thank you to our staff for allowing us to be able to claim this. It'll be a great recruiting tool, and I think it also helps us with our staff retention. Particularly with Amazon coming into the area, we are happy to be able to say that we're a great place to work. Let me turn my focus to our Philadelphia operations and research. We have been granted, grants came through in January, but the money is now beginning to start to flow. $20 million from the National Cancer Institute for our continued research in the National Clinical Trials Networks. The radiation oncology research has continued to be prolific, and with 5 major papers and multiple presentations at the recent ASTRO meeting. The head and neck cancer staging, Dr. Lee, you'll hear this evening in the convocation. I am happy to say, Dr. Lee, that was part of the work. 7 peer-reviewed articles from the Neiman Health Policy Institute that Geraldine cited. So again, the research continues to be very positive. The IDEAS study that was actually published in JAMA about the imaging of dementia, the evidence for amyloid scanning, where 16,000 patients in an evidence coverage with evidence development, just like the NOPR, that allowed practices to be paid for this research for the PET scanning that was done, showed a 60% change in the management of patients with either minimal cognitive impairment or with dementia. So a really, really impactful study. The TMIS trial is underway, and we're going to accrue 160,000 women with ECOG Akron in order to assess breast tomosynthesis. It's a reimbursed study, so those of you who your practice has not yet enrolled, please go to this website, contact us, and allow us to enroll you in that process. A terrific award was just given to our PR and marketing team, and as well as quality and safety for the imaging. Was this campaign, which has both posters and video, and I encourage all of you to go to the website and see these. But the American Society of Association Executives gave a Gold Circle Award for this public relations campaign. The publications team also received the Silver Regional ASBE Award for the articles within the ACR Bulletin, and our Imaging 3.0 in practice continues to be prolific with quarterly supplements to the Bulletin, and I encourage all of you to read those cases as they come through. Our social media presence in the bar graph that you see at the top, you can see the red column is 2019, how we've continued to grow in that very important communication platform. The communication on publications and lifelong learning, and my thanks to Lori Diet and her commission as we've reformatted and reorganized, completed their mission statement, and has identified all areas of educational efforts within the college. The wellness program, the well-being index that you heard cited in the talk earlier, has been implemented for all of our members, approved by the Board of Chancellors in order to make it available to all practices, private, academic, and be able to assess burnout within our radiology community. The Radiology Leadership Institute, we know that leadership is going to be critically important as we move forward in these very dynamic times in healthcare, and the Radiology Leadership Institute has reformatted itself to career bands of young physician section, resident fellow section, and early career, mid-career physicians, and then experienced leaders. And we're really pleased with that restructuring and the offerings that are available to all of you, depending, and you can get into any of those areas for the content rather than have to do it sequentially. Our Quality and Safety Division has really done a terrific job with the onset of the PAMA legislation, but also we need to report then through, in the macro legislation, the QCDR, the Qualified Clinical Data Registry, is now reporting on over 5,000 unique radiologists around the country. The differential pricing, as I've evidenced there, between members and non-members, I think more than pays for member dues. The interactive web page allows them to test themselves against the measures that are out there and get that preliminary feedback. And the registries that we're developing are rapidly expanding, including the lung cancer screening registry to facilitate that very important screening exam. The RScan, which is now in the last year of its CMS-funded accumulation of data on improvement of optimization and appropriateness of diagnostic imaging, has been tremendously successful, and then we're now rolling that into a registry to be able to continue to aggregate data on the use of that. And this is just one example of a case study where the imaging in low back pain the appropriateness of imaging in low back pain was very much increased within this practice. We've got a whole aggregation of such case studies and an article coming out very soon in JACR looking at a total accumulation of those. The practice parameters and technical standards, we heard very clearly from Resolution 43 last year, and you'll be hearing some more about that in the times to come, but the practice parameters and technical standards review process is going to be markedly improved. I would like to take this time to announce the establishment of the Fellowship in Medical Physics, named after Dr. Rick Morin. And as I say, this was approved by the board in January, and really glad to add that to our multiple fellowships within the college. You'll hear from Dr. Rawson regarding the membership value and engagement evaluation by that task force. I'm happy to say that our membership renewals are up. Our new enrollment of members is up, and the Career Center continues to be a tremendous asset as far as matching practices and departments that are seeking new partners and the members in training and fellows that are finishing. So really a terrific effort. The information technology platform that enables all of our educational products now. Cortex is being widely used throughout the entire educational spectrum, case in point being the primary example, and they've issued over 500,000 cases for CME to our members. And then the Data Science Institute, Dr. McGinty mentioned, of course, it would be impossible to not mention the progress that's been made there. Again, I likewise encourage all of you to go to the booth and experience your opportunity as we try to democratize AI. We are developing vendor-agnostic platforms, and that's key to recognize. Vendor-agnostic platforms that will permit you to develop and refine algorithms on your data in your institution without having to worry about taking patient-specific data across firewalls. Now let me shift gears a bit and talk a few minutes about the external relationships of the ACR, both domestically and internationally. Our core purpose, as it says here, is to advance the practice, science, and professions of radiological care. And as Geraldine just showed you, our big, hairy, audacious goal or future vision is to make sure that radiologists are acknowledged as leaders in the delivery and advancement of quality health care. We know we're in an era of team-based health care. So in order to do that, we have to have strong external relationships. And this is actually the goal and the objectives within our strategic plan. And just to highlight that it's going to be done through communication, cooperation, and collaboration, domestically and internationally, and understanding, getting to the policymakers and those in charge of those decisions to understand the importance of radiology. Will involve patient advocacy groups, and the data science solutions for patient and population health will be a critical part of that. It really is a tremendously complex healthcare environment. We know that. And we can be Sisyphus trying to roll the boulder up the hill by ourselves, or we can work with our colleagues both within medicine and outside. And that's certainly going to be a much better way to go about it. It's not limited to radiology or medical specialty societies, but those, of course, are key relationships that I'll talk about. So if we think of this as a group of concentric circles about those external relationships, we start with our ACR chapters, our 54 chapters, 54 states, Puerto Rico, District of Columbia, Canada, and Caros. They've signed affiliation agreements, so those are now formalized. We have strong support for the chapter leaders and had a great program for those leaders yesterday. We have multiple networks so that we connect those chapters through the Radiology Advocacy Network, the Contractor Advisory Committee Network, the Managed Care Network, in order to make sure that there's good open communication. And this is increasingly important with so many payer-specific and Medicaid issues that are state-based. Now you expand the circle out to the radiology societies. We have regular meetings, commonly at the RSNA and at the recent Association of University Radiologists meeting, with virtually all of the subspecialty and academic societies. We have common attendance of our ACR leaders as speakers at many of their society meetings. And we convene the Inter-Society Summer Conference every year, last year on the topic of burnout, this year on the topic of developing highly functioning teams and following up on the burnout discussion. The integrated efforts we do at CPT for proper coding and at the RUC for proper evaluation, the ACR continues to be the coordinator of those efforts. We have a great program with the Association of Program Directors in Radiology. We have established an end rotation exam so that members in training can be assessed at the end of their chest rotation or musculoskeletal rotation as far as their proper learning. And it provides immediate feedback to the benefit of both the program directors and the members in training. Now we'll expand to a little bit larger circle, the international radiology community. And our position as the continental member on the International Society of Radiology's Executive Committee allows us to have a direct voice through that organization to the World Health Organization, the International Atomic Energy Agency, and other areas of influence. We have collaborative efforts with the European Society, Canadian Society of Radiology, or Association of Radiologists, and others. And the ESR, European Society, has actually built an appropriate use criteria mechanism to be used throughout Europe based on our appropriateness criteria, what they call the ESRI guide. Our American Institute of Radiologic Pathology reaches out and gives programs all around the world. Our Ed Center attendance is very international, and we in fact have an Ed Center course that we give in Australia and New Zealand each year, both to the clinical teaching benefit and economic benefit of both organizations. The RADs, the BI-RADs, TI-RADs, other standardized reporting systems are now widely disseminated throughout the world. Our practice parameters and technical standards, many of which will be considered at this meeting, again, are widely accepted and well received around the globe. And our international sites that involved in the ACR-supported research through our Triad platform of allowing those images to be moved has been, again, a real boon to the international involvement in our research. And our registries, we know, are also going to be gaining international attention. Outside radiology in the House of Medicine, we have a very strong presence under Dr. Van Moore's leadership at the AMA, where our delegation leads the Radiology Section Council. And we now have members on the Board of Trustees, and I'm happy to say our Board of Trustees member, Dr. Scott Ferguson, is here to receive his fellowship tonight. And members on 4 of the 6 major AMA councils. The second major overall medical organization, the Council of Medical Specialty Societies, which represents, through their organizations, approximately 800,000 physicians. We actively are engaged with that group. I participate in the CEO component group and many of our staff on the multiple other component groups to share best practices in medical societies. Some recent AMA policies were really critical. Because of this influence is their support, and AMA policy now supports lung cancer screening in high-risk populations, and at the most recent meeting also supports coverage for advanced imaging for breast cancer for women at high risk and with dense breasts. We have some unique relationships with the AMA. One was already mentioned, the Education Hub. We're the first society to participate in that. And also we've had for over 15 years Clinical Examples in Radiology, a joint publication by the ACR with the CPT Office of AMA. But we extend our reach even beyond those organizations. The eHealth Initiative Group here, a think tank in Washington, we participate in their roundtables to promote things, particularly most recently for prior authorization or the elimination of prior authorization. And through our association and affiliation with the National Academy of Medicine National Cancer Policy Forum to promote lung cancer screening and other efforts. But finally, the biggest portion of the circle, or the largest circle, is our patients. And through affiliations with many patient advocacy groups, including the Komen Foundation, the National Lung Cancer Alliance, we're able to reach out to them. We promote our radiologyinfo.org, which now gets over 2.5 million hits a month in order to advance our what radiology care means to patients. And JACR has recently implemented the patient-friendly appropriateness criteria. So again, reaching out to that population. So in summary, I think facilitated by the incredibly dedicated, talented staff, and with all of the volunteer efforts that we have, the college and our leadership has really achieved strong and effective external relationships and will continue to do so. These are important both intrinsically to our strategic plan, but I think most importantly to be sure that we're serving the patients as best we can. So my thanks. I hope you all enjoy ACR 2019. And Mr. Speaker, I'll turn it back to you.